I'll take it from here. Thank you, Bob. Philadelphia's COVID-19 numbers have jumped from 1% to 5% in 1 month, prompting officials to call on indoor businesses to verify guest vaccinations or require masks. So Mayor Kinney, in the press conference yesterday when they made this announcement, he couldn't hide his frustration.
Not if everybody acts like a mature adult and does what they're supposed to do. We don't anticipate a lockdown. We didn't anticipate doing this a couple months in July, June and July. We didn't expect to be doing this, but you can see the level of immaturity around the country.
And so here's where we stand. And he went on more to talk about how frustrated he is about the fact that folks just won't get the vaccine and they don't want to wear masks. But here's where we stand in Philadelphia right now. 77% of adults have had at least one COVID shot. This is for the city of Philadelphia. And then 63% are fully vaccinated. And according to the latest CDC numbers, Pennsylvania ranks 5th in the nation for total doses administered. So we want to bring in our health commissioner of Philadelphia, Dr. Cheryl Bettigole. Thank you so much for coming in, especially after that big announcement yesterday. Good morning.
Good morning. How are you?
We're doing all right, and we want to make sure that everyone understands this new mandate that's now in effect because it happened at midnight. So first, I will say, before we get into the different situations and scenarios, considering that Pennsylvania is 5th in the nation, and then also that when it comes to our vaccination numbers, they seem pretty good. So why is it that we've ended up back here?
Well, so our numbers are pretty good. And, when I try to understand this, I've actually been looking around the country at what's happening in other cities, not just in places like Arkansas, Missouri with very low vaccination rates, but at places that have higher vaccination rates but are still seeing their numbers jump. And the place this past week that I've been most interested in is Austin, Texas. Austin has very comparable vaccination rates to ours, not 90%, but really pretty good. Their hospitalizations have soared. And it's because we're affected not just by what we do, but by what those around us do. And I think that's what we're seeing here in Philadelphia. We were protected for a while, our numbers stayed low. But we're not an island as a city. People come and go from Philadelphia and they can bring COVID with them and pass it to everybody else, especially people who remain unvaccinated.
Okay, so then when it comes to the rules then, basically businesses, workplaces, they all have a choice, right? Either require vaccinations for folks to enter or require everyone to mask up. Is that the simplified version of it?
That's the simplified version. This is really going back to a mask mandate. We just created a little carve out because we know a few businesses are requiring vaccine and we didn't want to get in the way of the places that are doing that because that will also work. But we're assuming most businesses at this stage are likely to simply require masks.
Okay, and when it comes to it, because I noticed during the press conference yesterday, there were a lot of questions about enforcing it. And when you say that the businesses or the entities, that they're going to be the ones, if you have a vaccine requirement, they need to actually check for proof. You can't just say, hey, yeah, I'm vaccinated, it's cool. You have to actually see it.
Right, so for those few places that do have vaccine mandates, I think this is what they're already doing. Mm-hmm. But certainly if you're going to tell people, yeah, everybody who comes in here is vaccinated, please make sure that's true. Take a look at the vaccine card. We know there are a few people faking vaccine cards, but the majority of people are going to show it if they have it, and otherwise will choose to go somewhere else.
Because I have heard a lot of times it's been the honor system, Dr. Bettigole. So that's one reason why I'm bringing it up, where they just say, oh, if you're vaccinated, you're fine, and they don't ask.
So, they do need to have a reasonable system that they are checking if they're going to tell people that everybody inside is vaccinated, because what will happen is people who maybe are vaccinated but are at higher risk, people who are elderly, people who are immunosuppressed, maybe they're going to be coming inside on the understanding that people are vaccinated. We want that to be true.
Okay. Now, when it comes to restaurants and bars, the rules for that, you need to have, I'll have you say it because I want to make sure we're all getting this right. What are the rules then when it comes to restaurants and bars?
Yeah, and we've just gone back to what we did fairly early on in the pandemic. People need to be masked unless they are seated and actively eating and drinking. And what that'll do is the establishments where people are kind of packed together drinking, people will need to be spaced a little bit to sit down at the table, keep the mask on unless they're eating and drinking. we're just trying to kind of tamp things down a little without having to close down businesses.
Okay. And when it comes to, because we have had a number of restaurants say if you're going to dine indoors, you have to show proof of vaccinations. For those restaurants, does everyone need to be masked if they're checking for vaccinations?
No.
Okay.
No, they don't. And similarly for gyms, I know some gyms have gone to a vaccine mandate because people don't want to exercise with masks on.
Gotcha.
That's a reasonable choice.
So what happens then, because it's right now the vaccine is for 12 and up, if you are a family and the majority of folks who are eligible for the vaccine are vaccinated, but let's say you have younger kids who are under 12 who can't get the vaccine, are you able then to still go indoors? Or you have to eat outside now so everyone can eat together?
So you could do one of two things. You could choose a restaurant that doesn't have a vaccine mandate, and you could just have your kids masked, unless they're under 2, of course, but have them masked except while they're eating and drinking, just like everybody else. Or if you've chosen a restaurant that has an indoor vaccine mandate and lets people eat outside who aren't vaccinated, you could do that. There's not that many restaurants, but I think some are going in that direction.
Okay.
I will say, for families with young kids, it's not a great time to take unvaccinated kids indoor to eat.
They are saying we don't recommend it anyway.
Yeah, I mean, and that's what I'm hearing from a lot of parents, that they wouldn't want to do that anyway. I think the fear people have, which I really don't think we have to worry about at this point, is that grocery stores will start requiring vaccine and they won't be able to take their kids shopping. And, to that, I would say, we're not going away. I'm still in Philadelphia. The mayor is still in Philadelphia. If that were to happen, yes, we would have to tweak things. But for right now, I'm not aware of any grocery stores in the city, any pharmacies in the city that wouldn't let people in if they were unvaccinated. They would just have to mask.
Just have to wear the mask. So let's talk about how it's a really big day for sports in South Philly. We have the Phillies game.
Yes.
We have an Eagles game. What are the rules? It sounds like everyone will need to bring their mask if they're going, right?
Yeah, I mean, people at this stage should be carrying a mask with them. That's going to make your life simple. Put it in your pocketbook, put it in your car, put it in your pocket, whatever you need to do. But you only need it in indoor spaces, or, there's another exception for crowded mosh pit concert kind of situations. But at a sports game, if you're going to go indoors to the bathroom, to an indoor space of some kind, you'll have to put your mask on. But when you're seated in your seat, or when you're in your seat, you can take it off. When you're eating and drinking, you can take it off. So if you're outside in a seated area, you wouldn't have to mask.
And that's what is an interesting part that some folks are trying to understand, because I know you mentioned concerts. That's a different thing, because if it's more than 1,000 people gathered and there's not assigned seats, so if everyone's just standing in a crowd, you have to wear a mask. But then why, when it comes to sporting events, if you're seated in a seat and you're pretty close to people, if you're, you know how the seats are, stadium seats, you don't have to wear a mask. Is there a difference?
There is really a difference. So if you take a look at some of the pictures of what's happened at local concerts, people are packed together. They are, having a wonderful time, but they are not masked and they're like sardines. And, when we're at a sports game, yes, people are relatively close compared to, outdoors in a park, but you're only, but so close to so many people. It's not the same kind of sardine can situation. And again, we're going to watch numbers with this. We may have to do more.
More like, now a lot of people, their ears are going to perk up hearing that. More like lockdown, or?
I mean, what we're doing now is to try to avoid lockdowns.
Okay.
Lockdowns are terrible for people for lots of reasons. So we're asking people, follow the rules here, put your mask on, use some common sense. Don't gather in super crowded indoor situations right now, especially if you're high risk. I mean, if you haven't been vaccinated, you need to take extra care. If we can do this together, and I've realized that some people are not going to get vaccinated, and those folks need to take extra care because not only are they at risk, but they're putting other people at risk.
Okay, lastly, because I know we have to go, is there a certain threshold where we can go back to not having to wear masks? Like if, let's say 85% of folks get vaccinated, then is that the only option for going back to, okay, you don't have to wear your mask when you go indoors?
So for all of this, we look at a set of numbers, not just one single number.
Okay.
So, presumably if vaccinations go up, what we've seen everywhere else is cases will go down, hospitalizations will go down. Cases alone are less important, but if your hospitalizations are going down, if your positivity rate's going down and so on, then you feel safer. So right now, we are really not in that situation. We just crossed the threshold to high transmission, according to the CDC. Mm-hmm. We have to do something. So, I want people to recognize this is a very high risk situation. The numbers are not that high yet. They are shooting up. The graph just does this, and we need to turn that graph around right now.
Okay, well, thank you, Dr. Bettigole. I know yesterday was a very big day after the announcement, so I appreciate you coming back on to help clear this up so folks can understand. And thank you for the work that you're doing.
Thank you for covering it and helping us get the word out.